Hi, dear viewers and listeners of Equinoxe Radio Multimedia. Good afternoon. It's a pleasure joining you on yet another edition of the program You're in Health aired on Equinoxe Radio Multimedia. We'll be talking about an important topic. Can you guess for just a few seconds? I hope you guessed right. We are going to be talking about asthma. An asthma attack can really be scary. For some people who might see such a situation for the first time, you might even think the victim is going to die. But yes, if care or precautions are not taken, something bad might happen to that person. But then how can you help revive such a person in such a condition? That's what we'll be giving answers to in the second part. Stay with us as we meet our guest in some few seconds. Thank you so much for staying with us. My co-host today is Ase Lucy Liengu. Hello, you're welcome.
Hello, Immaculate. Good afternoon. Good afternoon to all the listeners and viewers out there. We are glad to meet you again on the program You Are in Health.
Oh, it's a pleasure being with you on the program.
It's a pleasure.
So, Lucy, I give you the possibility of introducing our guest for today.
Yeah, of course, our guest is special. She's always with us. It's no other person than Dr. Glory BEFEKE ANYE. She is a general practitioner. Good day to you, Doctor.
Good day, Lucy.
Good day to you, Doctor. It's a pleasure to have you on the program today.
Good day, Immaculate, and thank you for the invitation.
Doctor, we'll be looking at a very sensitive topic known as asthma. Tell us, can you please define what asthma is all about?
Yes, asthma is a chronic respiratory infection, which usually is characterized by inflammation or the narrowing of airways. And once this is inflamed, the airways are inflamed, it can lead to difficulty in breathing.
Now that it can lead to difficulty in breathing, that's already a symptom. Are there other symptoms to watch out for when we are talking about asthma?
Right. We have wheezing. You hear someone wheezing. Sometimes the wheezes are too loud, not only with the stethoscope. We equally have a cough. You see someone coughing. That may be an indication of asthma attack. You see someone having a tight chest and the breathlessness.
Lucy, she just made mention of wheezing. Do you understand what wheezing is all about? I think our mothers who might be in the market or the place, they won't even understand what wheezing is all about. Can you break it down for them?
Right. When you sound a whistle, the sound is just like that of a whistle. You really, sometimes you get the individual really emitting such a whistle sound. And sometimes when it's not very audible, the doctors can get it through the stethoscope. Sometimes we put the stethoscope, it's an apparatus that the doctors use on the lungs, and we get how during exhalation, that means when you're sending out the air, you can get these wheezes. Like, so just imagine someone blowing a whistle. Yes, it's a whistle, whistle sound. Whistle, you know, when you blow the whistle.
Yeah. Yes. Exactly. So what can trigger asthma? Some factors.
Yes, we have many factors. The allergens. Allergens, we usually have them from pollens. Pollens that come from trees. They can come from weeds like maize on the field. They can even come from grasses, you know, the grass on the field. So pollen to some is a trigger, can trigger this asthmatic crisis. We equally have a dust mite. The dust mites are some tiny insects that sometimes we may not see, but they linger around the household and they can trigger asthma. Sometimes cockroach droppings. Yes, cockroaches. The droppings from cockroaches can be an allergen to one, and that can trigger an asthmatic crisis. Equally, mold. You know, when the house is cold, mold, it can equally trigger. The allergens, we equally have respiratory infections. Respiratory infections, like one who is coughing, who already has cough, the cough can trigger an asthmatic crisis. Sinusitis can equally. Cold, flu, all fall under respiratory infections, which can trigger the asthmatic crisis. Equally, we have a physical activity, like vigorous physical activities can equally trigger. We equally have changes in the weather. Sometimes very cold weather, sometimes dry air can trigger this asthmatic crisis. Medications as well. You know, those who are used to over-the-counter medications like the non-steroidal anti-inflammatory medications like the diclofenac, the ibuprofen, you just see to go and buy. For those who are asthmatic, with such a practice, it can trigger the attack.
Okay, doctor, before we fetch ahead, we are giving out the numbers for those who like to contact us or to join us on the program. The number is 670-547049. I repeat, 670-547049 or 656-622222, 656-622222 at the end. So, doctor, we continue. What test? Let's talk about a test that is associated in diagnosing this asthma.
For a proper diagnosis of the asthma, the clinician first will do a clinical exam on the individual, check the medical history, carry out physical exam, and may end up with some lung function tests. Some of such lung function tests really like to isolate or to confirm that is an asthma or asthma. We have lung function tests like the spirometry measurements. We can measure the exhalation, that means the time when the patient, when the client, the individual is breathing out, and inhalation, when the individual is taking in the air. So with spirometry measurement or test, this kind of measurement is made, and they want to see how much the individual is breathing. Equally, apart from the spirometry exam or test, we can have what we call the peak expiratory flow measurement. The peak expiratory flow expiration is a kind of measurement that it measures at what level the one is sending out the air. We can equally do chest x-rays, CT scans. This is when the infection is suspected to be associated with a comorbidity, maybe sinuses or a cough. So we have this. We can equally have the allergic tests. Some allergic tests like blood tests like the immunoglobulin E. Equally the skin prick test. Those are the allergic testing that we can equally carry out.
Now, what's the earliest age that someone can be diagnosed with this asthma?
Right. Asthma can be diagnosed at any age group. From 2 years or even below 2 years. Now, when it comes to the infants or the toddlers, it becomes a little bit complicated because some of these lung function tests, like the spirometry, like the peak expiratory flow measurements, they want to give you some orders, breathe in, breathe out, and all of that. So for this kind of age group below 2 or those toddlers, it becomes difficult to really confirm at that age. But with common symptoms like the wheezes, like the coughing, like difficult breathing, chest tightness of the chest, it can already be an indication. However, there are other infections that can manifest with these symptoms, signs and symptoms. But where we have a persistent and continuous signs and symptoms of wheezes, coughing, shortness of breath or difficult breathing and chest tightness, we will start to check that individual from such an early stage. Now, when it goes to the adolescent age, it becomes very easy because we have this confirmatory testing or tests that we can carry out.
Let's focus now on the child. Well, now you're talking about even less than 2 years old. While mentioning the factors that can trigger cancer, you talked about pollens, you talked about dumps from the cockroaches or whatnot. Now, we are talking about kids, and these kids, I don't think this will be connected to this. to all these factors you mentioned. Apart, maybe there's another factor that might trigger such when it comes to kids.
Right. We saw the respiratory infections. That respiratory infection can be a trigger. So with these infants or the toddlers, they are usually exposed to colds, to flus, and all of that, which can be a trigger to such an age group.
And can asthma be hereditary?
Yeah, it can. It can.
Okay.
Okay, so when you are being diagnosed with asthma or you're an asthmatic patient, what is the next step? What next to do?
Right. Anyone diagnosed with asthma should keep in touch, should work with his or her healthcare provider. This healthcare provider, be it the specialist, maybe the pneumologist or general practitioner, the healthcare provider is going to help the one to come up with an asthma action plan and a management plan. Here, the practitioner is going to help the one first to identify his or her trigger, because not all the asthmatic patients have similar or the same triggers. What can trigger my asthma may be different from what can trigger another person's asthma. So the healthcare worker is going to help this individual to identify his or her triggers. In this way, helping him or her to avoid attacks. Equally, the healthcare provider will educate the one, and equally guide on how to take his or her treatment, and equally follow up the individual on the things he or she has to avoid. So once you've been diagnosed with an asthma, you should stay very close. You should work with your health care provider.
Lucy, still talking about the lifestyle, I want to know, when it comes to food, are there some major spices or food that can trigger this?
Right. Now, when it comes to food,
like
the fried, not
Hot
really.
pepper.
Not really.
Because I used to get some asthmatic patients telling me that whenever they eat pepper or spicy food, they tend to have some pain on their chest, and the asthma just provokes it.
Right. These are individuals already with what we call the gastroesophageal reflux disease.
Okay.
These are comorbidities that go to irritate a kind of gastritis, and once that is irritated, the acidic content within refluxes, and once it refluxes, there can be a tendency that it gets into the lungs and it irritates, because the triggers I didn't mention the irritants. You know, irritants are equally triggers, so it can irritate the airways, and it can provoke this. So when talking about food like frying, you see these people who bleach oil. They may not really it may not really be friendly to the airways. It may irritate and provoke.
Okay, doctor, so how can asthma be treated? Is it treatable? How can it be treated?
Right. The treatment available for asthma is to manage the symptoms and to keep those symptoms under control. Since asthma is a chronic infection, it has no cure. It cannot be cured. But it has a treatment that can keep these symptoms in check, in place, so that the one will avoid having attacks. Now we have short-acting medications. We have short-acting medications like albuterol. Practitioners will understand when I speak like this. We equally have long-acting medications, or long-acting medications can equally be used in the treatment of the asthma. So these medications, both the long and the short, they can be passed through inhalers, through those devices, which is a medium or a means by which the medications are introduced directly to their lungs.
So do all the asthma patients need these inhalers you're talking about?
Not all asthmatic patients, not all, because depending on the severity, depending on the frequency of the symptoms. For example, those with mild symptoms may just need some lifestyle changes. Okay. Once they practice some lifestyle changes, then they can manage, and they'll hardly have severe attacks. But those with moderate to severe symptoms, attacks, are obliged all the time to go around with inhalers.
Are all inhalers the same?
No, these inhalers are not all the same. That's why we talk about the long term and the short term. There are those that give quick relief.
Okay.
When the crisis is there, you see Vantolin, it's a kind of albuterol. It goes directly and it gives a kind of quick relief. And then there are those equally long term. There are equally medications that when one takes, it can help to avoid the symptoms. So it's a long term. We equally have other treatments that, like management of lifestyle, is a treatment, preventive treatment.
Okay, doctor, we are talking about the management of lifestyle. What are some activities, let's say physical activities, that asthmatic patients can carry out so as to help them or ameliorate their health condition?
Right. With regards to the activities, we had identified physical exercise, vigorous physical exercise or intense, as a trigger, but it doesn't exclude asthmatic patients from carrying out or from indulging in physical activity, because they have to be healthy, they have to live healthy. So any asthmatic patient or asthma client must work with his or her healthcare provider. The one is going to help manage the kind of exercise that he or she has to indulge in order to keep the functioning of the lung healthy. Equally, talking about the exercise, we equally come to keeping the environment clean. We have identified cockroach droppings, we have identified mold, spores. So if you live in a healthy environment, you keep your environment very healthy, then it will help you to avoid any attacks.
Doctor, in case I'm coming to work and I see a girl and I notice that she has all the symptoms you've cited, what is supposed to be my first plan of action?
Your first plan of action is to take the one to a nearby health unit.
But now, if the health unit is quite far, let's say we are in the far north, in an area where hospitals are 10 kilometers away or whatever, what should I do to be able to save that person's life at that moment, the first aid I can apply?
Right. For mild, well, in that situation, it's already severe, I'm sure, because you cannot see one.
I can't even tell if it's severe or mild. Yes.
Normally, when it's severe, you see the one already having those difficult breathings. You see that you get the wheezing sounds and all of that.
Okay.
So, before one gets to that stage, the healthcare provider must have prescribed an inhaler and must have advised the one to always go around with his or her inhaler. Okay. So what you do is to help the one, ask if he or she has an inhaler on, or you check, because sometimes even to talk is difficult. You can check around if the one has. If maybe it's the first episode, you can check to see what triggers can be around. For instance, if it is cold weather, you can see whether you can keep the one warm. If the air is dry, you can see if you can mask, you can cover the nostrils or the mouth to reduce the attacks. So knowing the triggers, the kind of triggers, can help to give a first aid to one who has symptoms, severe symptoms.
So can asthma be treated, or does it have a cure, like to say?
You said there's no cure?
There's no cure.
There's no cure.
Wow.
Because it's chronic.
Like, I'm asking because some people might think that if you go traditionally, you might have a cure, not medically. I don't know if maybe a patient suffering from asthma can go traditionally to have a cure.
Going traditionally will end the one having so many other diseases, so many others. So it's about going to the hospital. There is no cure for asthma. There is no cure.
Wow.
What the management aims to do is to bring each one with asthmatic crisis on a mild level, so that the one will never have a severe attack. So once the one has been stabilized and never having crisis, that is the kind of treatment, is a management. But to say that you get cured of it totally, completely, no. You can have some asthmatic patients who will hardly have exacerbated signs. You hardly have them having those attacks, because they maintain the lifestyle. They know what they have to do and what to avoid.
Given that you work in a very big hospital, the St. John's, tell us, are there several cases of asthma, or is the number is not really significant?
Yeah, we have some cases of asthma patients. We even have some mothers, when they deliver, some of them, they express with asthmatic crisis. We have some pregnant women with asthmatic crisis. We equally have children coming with such crisis, and equally some adults. So we have quite a good number of patients, and we are managing them to modify their lifestyles, and equally to advise them where need be. If they
Doctor, we'll have this call on the line. Let's just take it for a short minute. Hello?
Good afternoon, madam.
Good afternoon, sir. Your question and your name, where you're calling from?
My name is Nyam Christopher from Bole Bakundu along Bonga Road.
Okay, sir. Your question.
Yes, I want to ask the doctor, what causes, or what are the conditions that causes the airways to get inflamed?
Okay. She'll be answering that. Thank you so much. Some few seconds before we end. You got the question?
That what are some conditions that causes the airwaves to get inflamed?
Right. We've talked about respiratory infections. Cold, flus can trigger your airways to be inflamed. And once the airways are inflamed, then you are susceptible to having the asthma. Equally, medications. There are some medications. There are some people who are of the habit each time, just as we mentioned, taking this over-the-counter ibuprofen, aspirin all the time. It can lead to, you take these medications are to reduce inflammation. That's what we know, and to really reduce pain. But when you take it in an abusive manner, it will trigger the inflammation of these airways, and it will result to asthmatic crisis.
Thank you so much, Dr. BEFEKE ANYE, General Practitioner. It's a pleasure to have you on the program today.
Thank you, Immaculate.
Equally big thanks to you, Lucy, for being part of the program.
Always a pleasure.
And that's what put an end to today's edition of the program You're in Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. I received assistance from Ephraim Yemeli, Jonathan, and also Bertrand Bonzini. Have a wonderful day in the company of more interesting programs on Equinoxe Radio and, of course, television.